I don't know that there's been a time and a place in my career that cleaning and disinfecting and associates that apply and execute those services have become most important than it is today.
On today's podcast, we are going to sit down with Rich Fezcko, National Director of Standards and Innovation at Compass One Healthcare. We'll also take a few minutes to chat with two of our incredible partners in infection prevention, Surfaceside and Virtual Manager. Now, as most of you know, Rich has helped position Crothall Healthcare and Compass One Healthcare as the industry leader when it comes to patient safety. And folks, during this pandemic, he is even more at the forefront of the battle of infectious disease and HAIs. Rich, I know you are a busy man, so thank you for taking the time to join us today on Compass One Connections.
Thank you, Tom. I appreciate the time for sure.
So when I read off National Director of Standards and Innovations, for those of the people out there that don't know, can you just tell us what that means and what you do on a day-to-day basis, Rich?
Yeah, absolutely. From a standards and innovation standpoint, my role is multi-tiered, of course. With regards to the standards component, my responsibility is to make sure that I enforce, reinforce, and update our internal standards applications and platform nationally. I support not only our environmental services side, but also our clinical engineering, facilities management, patient transport, and laundry. I also have a connected line with what we're doing with food nutrition as well, which is exciting because that's when it gets into some of the innovation points, which I'll talk about in a moment. From a regulatory standpoint, I make sure that we're armed with the right information related to Joint Commission, CMS, OSHA, and other accreditations and deeming authority mandates that our folks abide by on a daily basis. The exciting part is the innovation, where we're able to look at such devices as UV technology, electrostatic applications, and other applications in the industry that help reduce hospital-associated infections and optimize the patient safety throughout all of our facilities. And in fact, even in other categories such as education and on our business industry side, helping with student safety and people safety alike.
It sounds like you've said that a few times before, Rich.
I have.
Yeah, it sounds great. You have quite a lot of responsibility. During this pandemic that we've been going through, Rich, your job is just obviously just super important to everything that Compass One Healthcare is all about and doing. Talk to me a little bit about just what you faced with this COVID pandemic.
Yeah, in regards to the current pandemic that we live in with COVID-19, my responsibility primarily has been to be the point person for interaction from deeming authorities and to protocols to the field. And an example of that would be the pivots by the CDC, in particular with masks and PPE opportunities nationwide. We've been able to adjust and modify our practices in accordance to those pivots, where I come in as well, circulate that information to the field, meaning that we operationally have the most robust systems in place to support what our services require. Technology is included there as well.
So, Rich, during all of this, on a personal level, tell me what you've seen from the troops out there, the Compass One Healthcare folks that are out there just dealing with this COVID pandemic day in and day out in the hospitals. What have you seen from on a personal standpoint of these people just really rising to the occasion?
Yeah, that's a great question. My observations have been from East Coast to West Coast, North and South, starting with what we faced in the West Coast in the Seattle market and California as early adopters with the COVID instances early on in February. Our folks were immediate action takers. They were able to connect me in with regards to helping support them in the process. And quite frankly, there were a lot of apprehensions in all of our levels of not only management, but hourly associates to make sure we were doing what we needed to do. So coupled with not only our practical from East Coast to West Coast, North and South, and our ability to communicate out what we were trying to accomplish with regards to those pivots that I mentioned with the CDC and other authorities, but also some of the messaging from Bobby Coute and others within the organization to reach those folks, assuring them that we were doing the right thing, not only from a practice standpoint, but ultimately patient safety and associate safety is paramount in all that we do.
Yeah. Let's shift gears just a little bit, still kind of in the same realm here, and talk about the white paper that you guys have coming out. What is the purpose of a white paper, and why is it so important? Why is it so important to Compass One?
Fantastic question. Something I'm very proud of. About 10 years ago, we recalibrated our infection prevention approach, looking at more of the practical components upwards to innovation and adjunct technology. And over that period of time, we have published, now this is our fourth white paper document, that helps with regards to explaining protocols, industry standards, and also what we have found to supplement and innovation, the helpful tools and resources we can work to mitigate HAIs, to optimize patient safety, and to help our clients achieve the benefit of a holistic environmental safety program from what we're trying to achieve. This white paper consists of 5 pillars, as the past have, starting with hand hygiene. And as you probably know, and as the audience knows, we have heard no more about hand hygiene than we do today. Hand hygiene continues to be paramount, spotlighted as the number one reason for virus spread and so forth. So we have that number one in our roster. Process, people, and products are number 2. It's a deep dive into not only our methodology with high-profile cleaning, but the appropriate products and disinfectants and the people that are executing those services. To measurement, what does it all mean without measurement? We in our organization use ATP to quickly measure the efficacy and the application on surfaces such as bed rails, elevator keypads, and so forth. And then it gets into the adjunct technology like UV that I mentioned earlier. But the cool thing is in Pillar 5, it doesn't stop, where we're always looking at best-in-class innovation, helpful innovation, and validated information, intelligent technology that can help us take the next steps into the utilization of technology, innovation, and solutions that could be helpful from an adjunct perspective to drive down HAI events and risk for all of our clients nationally.
Speaking of technology and innovation, I recently spoke with Surfaceside CEO Gunnar Lyso about Surfaceside and their relationship with Compass One and Crothall.
Surfaceside is a multiple UVC emitter technology that uses or harnesses UVC energy to address the role of bacteria, virus, or spore that are known to colonize patient or healthcare environments. What I love about the relationship is several years ago, Crothall or Compass One went through an extensive due diligence process. They recognized that Surfaceside was bringing some real innovation to the UVC modality space. And in the interest of their clients, they then said this was the most effective means of distributing energy that we know is going to be effective at eradicating bacteria, virus, and spore. So the fact that we just have this really strong partnership, Crothall is doing it because they want to bring the most advanced technology to their client. In the end, the patients win because they're, entering into a facility and they're going to receive the highest level of care. The healthcare providers are winning because they are providing an environment that results in better outcomes. So they're leaning out cost, and Crothall and Surfaceside are winning because we're in a position to provide a really valuable solution. So it's just really a great relationship.
I also had the opportunity to sit down and talk with Tony Morocco from Virtual Manager. He discussed his tracking app and the value Virtual Manager brings hospitals in terms of labor efficiencies and contact tracing.
We're a software developer that provides turnkey solutions for niche markets to really increase visibility, transparency, compliance, and it can really relate to any workflow situation. Our overall goal is to reduce risk. And within certain niche areas of Compass and Crothall, especially in healthcare cleaning, we looked at kind of that paper process and how can we give power back or visibility back to management. Number one is, look at that paper process and digitize it through the Virtual Manager app. And that app is called Health Clean. So we have that deployed in over 30 hospitals. So we digitize that current process. Employees take, the app and have mobile devices on their cleaning carts in their pockets. They're able to go around and validate all the different tasks and cleaning tasks that they have. And then on the back end, management has the visibility of the dashboard to be able to look in and see productivity and communicate with their staff. And overall, we're able to kind of bring that historical data so that you can make intelligent decisions on the go. So real time, you're able to access where that cleaner was, or if you wanted to look at a particular room and if there was a confirmed or an exposure, you're able to trace back to that room of who entered that. And so overall goal is to be able to look at that. And if you need to do isolations for overall patient safety, the staff safety, and the environment in general, to provide that as a safe place to be.
A special thanks to Gunnar Lyso and Tony Morocco for joining us on Compass One Connections. Now back to our podcast with Rich Fezcko. Rich, when you look at the 5 pillars of this white paper, there's so much information in here. Why would someone who might be looking to outsource food and support services in the healthcare space, why would they want to read all this? What benefit would it really bring to them?
The benefit, I think, for our organization into any healthcare facility system nationally would be the intelligence and the due diligence that we put in from the back end to support our findings. It would be one thing if we were to say that executing the tool of high profile cleaning is just what we want to call something to do something, but to have science behind it, to have proven data, metrics, and outcomes that help us to achieve those hospital-acquired infection reductions in our facilities nationwide is really the catalyst. And that's where that paper comes into big-time play in showing those metrics, showing intelligent use, and showing the outcomes that our clients are wanting to achieve and to attain to produce those reduced rates nationwide, those reduced hospital-acquired infection rates nationwide.
When you talk about the pillars and the best practices, obviously, like you said, you were able to adapt to everything with the pandemic when you were building this white paper and kind of incorporate all that. But what is all that, the pillars, the best practices, what is that kind of impact does it have on the future of the hospitals and patient care, what you guys have built into this white paper?
Yeah, there are consequences to not conforming by the CMS and Centers for Medicaid and Medicare for making sure the hospital systems or standalone hospitals nationally conform to patient safety. These tools that we're bringing to the table by way of this white paper are best practices. So in our end, we are doing our part to support those returns, those reimbursement returns, so that hospitals continue to operate solvently, financially capable, to help and to honor their community and the needs of their community for patient safety, for elective surgeries, for every opportunity that they find, inpatient, outpatient, ambulatory care opportunities and offerings that they have. So the white paper really provides the support service intelligence to help our hospitals and our systems look at the best in-class provider, and the fact that not only from a service standpoint, we execute what we say we do,
right,
but also we can help impact their finances as well and driving down those hospital-acquired or hospital-associated infections that I spoke of earlier. So the power of clean has the opportunity to impact not only how we execute services from an environmental standpoint, but holistically, the patient safety element, the community element, the idea around what we've been able to produce metrically, scientifically through that document is able to convince and showcase expertise, outcomes, and that we care as an organization. We truly care as part of the healing team to benefit any organization that we work in, to help produce the best results for everybody involved. And in that paper, including not only the patient safety elements, we also have our own safety elements as well, where we are helping to reduce slips and falls and so forth. So it's truly a robust document. I think that message, I know it's long-winded, will help resonate with readers that are looking for that type of position, not only from a metric-based, from an outcome-based, but also a caring part of that we really are compassionate as an organization, and that's how we're able to line up various partners to help us produce that document.
I'll tell you what, Rich, your passion for what you do really comes through when we sit here and have this conversation about this white paper. I can tell your heart and soul is into this. You know, I've heard it said the last couple of days a few times, but Crothall and Morrison, Compass One Healthcare, they were really built for this type of situation, weren't they?
I think so. Yeah. I tip my cap to Bobby Couttet, Tom Roccobaldo, and Tim Pierce for having the vision to have an infrastructure in play so that we can build from that infrastructure, make seamless pivots to situations that we find ourselves in today, and a powerful team. Our frontline folks are the best in class. Our operational management and leaders in the field are best in class. Again, the power of clean, the power of food, it all makes sense. And we live it every day.
Great. Fantastic. So, Rich, thank you so much for your time today and for everything you do for Compass One Healthcare. But before I let you go, you are going to be put on the Compass One Connections hot seat. See, I like how you laugh already. That means you know what's coming. I like that. That's good stuff. We're going to put a minute on the clock. I'm going to ask you some questions to get to know Rich Fezcko a little better, and we'll have some fun. Are you ready?
You got it.
All right. Absolutely. First question. Rich, what is your dream car?
Wow. As a little kid, I had a Mercedes-Benz Matchbox car that had doors that opened up. So I think I'm going to stick to any type of Mercedes-Benz, just because that was my 8-year-old dream, and I'm going to stick to that story.
Favorite movie of all time?
Favorite movie, Big, with Tom Hanks. Part of the innovation mind, I think I have. Big, a 13-year-old kid transitions into an adult, gets to play with toys and checks things out. So I love that movie. Do
you have a pet?
I don't, but I had a fish. I travel so much, versus this pandemic restriction, but I had a fish. And if you've ever seen that movie with Bill Murray, What About Bob? I called it Gil, based on that movie. So I've had some fish in my day.
That's hilarious. Favorite hobby on your off time?
I've become a golfer, not very good. My kids and I try to go out and hit some balls, and I coach, I still try to coach baseball. So those are probably the two things that I do the most.
And last question for you. If anybody could play you in a movie, who would it be?
Oh, wow. I'd like to think, that's a great question. I'll just stick with Tom Hanks.
I like it. I like it. And he can even play the big role and still act 13 and it would fit, right? I like it.
That's right. That's
I like it. Rich, thanks so much for your time today. I know you're a super busy man, especially during this pandemic. And like I said, for everybody at Compass One Healthcare, thank you so much for what you do day in and day out to keep us all safe.
Thank you. It's my pleasure.
Okay, take care.
You too.
We sincerely hope you enjoyed this installment of Compass One Connections. As always, please be sure to rate us on the app that you are listening to this podcast. I'm Tommy Kane. Thanks so much, and we'll see you next time.